The campaigners who are trying to save the Bitterne walk-in service feel that they've already faced the possible closure of the service in the past, and they feel that this issue is now being revisited and brought to the table again. How have we got to this stage?
Well, part of the CCG's role is to constantly review services that are available for the people in Southampton, and to constantly look at where we get the best value for money, and spend the NHS money in the wisest way possible. So we're always looking at services and where the most and the least cost-effective services are, and we really want to try and invest in services that support the 1/3 of people in Southampton who have chronic long-term conditions, and in trying to support them in care at home. And in looking at that, the walk-in service often comes up as a service that is used less or used by less people in the city, and is less cost-effective than some other things that we can do. We recognise that people view the walk-in service as a valuable service, and that's why we were out to doing this consultation, to really just try and find out what people think, but also to communicate the reality of the situation we're in Southampton, that we can only spend the money once, and we have to try and find the best way to spend that money.
Residents also argue that the solution isn't to reduce health services, but to boost and bolster them. They say there should not be a choice between services, between community care or a walk-in service. What do you think about that?
So we have the reality of the situation we have in Southampton is that there is a limited pot of money that we can spend on health services, and it's the CCG's job to make sure that's spent wisely. We unfortunately can't pay for everything that we would like to, and we have to make these difficult choices. Much of our work in the CCG is around bolstering the community services, community nursing, and trying to make the services better able to support patients at home, to keep them out of hospital. And because we know that 1/3 of patients have a long-term condition, we think that that's the best thing for the population as a whole. So as part of making sure that we're providing cost-effective services, we need to, wherever possible, reduce duplication of services. And we feel that services like 111 really provide a better service than the walk-in service can currently provide.
Campaigners argue that the service is needed because it takes pressure off of doctor surgeries and the hospital. What do you think about that?
Well, that's a bit of a misconception, and we know from various places that that's not the case. There have been some big studies across the whole country from when walk-in services were first established, and there was clear evidence from those studies that they didn't reduce the impact on emergency department or surgeries or GP surgeries. And we know that from local data as well. As part of the walk-in service review, we have asked practices about the impact of the walk-in service on their surgery appointments, and 80% of the practices don't feel there's any impact on their services at all.
If the service is closed, what will that money be used for? How will residents see the benefits?
So we're not necessarily going to provide a new building or a new clinic that's available for people to go to. The point about where we want to reinvest the money is that we want to continue to support people in their own homes with managing their own medical illnesses and supporting them to stay out of hospital. And the way we can do that is by bolstering up the community teams. So that's district nurses, and the teams that surround them, so the community healthcare assistants, those kind of teams that at the moment very pressured and have really more work than they can deal with. We want to try and bolster them and make sure that they have the resources available to do what they need to do.